Hello guys, I am Shanmugapriya, lecturer in SNS College of Allied Health Science in the Department of Operation Theatre and Anesthesia Technology. So in this section we will be continuing with the basic terminologies. We have come to the end of the session. So the first we have already seen about anatomical position and its description, then about the body positions and its types like supine, prone and lithotomy position in detail. Next we have seen some directional terms, and also we have seen about regional terms like axial and perpendicular region, and also we have seen about the body planes under which we have classifications, longitudinal and oblique planes. In longitudinal planes we have seen in detail about the sagittal and coronal, and also about the transverse planes. Also we have seen some terms of motions like flexion, extension, abduction, adduction, external and internal rotations, supination and pronation, circumduction, inversion, eversion, protrusion, retraction. And also we have seen about the body cavities and its types like dorsal cavity and ventral cavity, in which we have seen about the cranial, spinal, thoracic, pleura, medial sternal, pericardial, abdominopelvic cavity, abdominal cavity and pelvic cavity. In this session we will be continuing with abdominopelvic quadrants and region. Identification of quadrants and region in abdominopelvic cavity helps clinicians describe the location of the many abdominopelvic organs. There are 4 abdominopelvic quadrants and 9 abdominopelvic regions. Abdominopelvic quadrants and regions are depicted in the image. On the right, we have abdominopelvic quadrants like right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. And next we have the regions, that is 9 abdominopelvic regions like right hypochondriac region, left hypochondriac region, right lumbar region, left lumbar region, right iliac region, left iliac region, epigastric region, umbilical region and hypogastric region. Abdominopelvic quadrants. The dividing line between these are centered on the umbilicus, that is belly button. Right upper quadrant contains liver, left upper quadrant contains spleen and left kidney, right lower quadrant contains appendix, and the left lower quadrant contains left ovary. Abdominopelvic regions. Dividing the abdomen and pelvis into region is done using tic-tac-toe grid. It is little more complex than using quadrants, but is also more specific. There are 9 abdominopelvic quadrants which have been listed a few seconds ago. Assessments. So, which plane divides the body into anterior and posterior portions? So, here the anterior refers to front and the posterior refers to back. So, the answer is coronal plane. Yes. Coronal plane divides the body into anterior and posterior portions, while the sagittal plane divides the body into right and left halves. Next, the transverse plane divides the body into superior and inferior portions. Horizontal plane is also another name of transverse plane. The term cranial refers to the structures that are located towards the feet, toward the head, near the heart, away from the head. Cranial is a term that refers to the brain, so the answer is towards the brain. Head. Next, the thoracic cavity is divided into 3 compartments. Which of the following is not one of them? Left pleural cavity, right pleural cavity, pericardial cavity and abdominal cavity. So under thoracic cavity we have pericardial cavity, pleural cavity, and also we have mediastinum. So in these options the left one is abdominal cavity. which comes under abdominopelvic cavity and not in thoracic cavity. So the answer is abdominal cavity. Thank you.